All right. Well, thank you very much for coming and joining us today. My name is Colleen Mc. I'm a first year social justice practicum intern in the PsyD program at Adler. And today I'm interviewing Daniel. Daniel, do you want to introduce yourself?
Sure. Thank you, Colleen. My name is Daniel Asadullahi, and I am a fifth year PsyD student in the clinical psychology program at Adler University, Vancouver.
Thank you. So, Daniel, I just want to ask you a few questions. The first being, what are your thoughts around mental illness?
I think mental illness is an issue that human beings have historically experienced for a long time. I believe there's evidence of mental illness, going back to thousands of years, probably from the beginning of human history on the planet. And it's been something that's been with us for again, generations. And I think mental illness is an issue rather that causes social problems as well as personal problems and interpersonal problems. And it has genetic and environmental origins. We know that, for example, there are certain genes that we can inherit from our parents and our family that predispose us to, that give us a vulnerability to developing disorders like depression, anxiety, schizophrenia, and so on. And so there's a genetic component to mental illness, but there is also environmental origins, like environmental stress. So if, it's possible that a person, I believe, in my understanding is that even if you've inherited a certain genetic predisposition to a disorder, it might not actually become that mental illness or give rise to that mental illness if the environment that you live in or that you grow up in is a healthy and nurturing one and a kind of a low stress one. Whereas an environment that's a family environment or a social environment that has a lot of stress in it, has a lot of kind of adversity in it, those things can actually interact with the genetic vulnerabilities and then give rise to a mental disorder, right? So, that's kind of what I think about mental illness in a nutshell.
Thank you. What about stigma? What are some of your thoughts around the stigma related to mental illness?
I think the stigma around mental illness is something that's a very negative phenomenon. I think it's something that, from my own personal observations, it seems is actually decreasing, in different societies. Some societies, I think, have historically had attached a lot of stigma towards mental illness. However, because of, I think, increasing education and kind of people becoming more familiar with what mental illnesses are and, how they can be treated and all of those things, people are reducing, or we're seeing a reduction of that stigma attached to mental illness. And that's a very good thing. And it's important to remember that anybody in their life may experience some mental difficulty or psychological difficulty that they need help with, and one should feel totally free to seek help with those issues, right? And we have a similar approach when it comes to medical problems and physical problems. Any of us might experience one of those problems in our lifetimes, and we go to the doctor for it. We try to get help for it. And I think it would really be helpful to take the very same approach towards mental illnesses. Any one of us might develop a mental issue during our lifetime. The statistics show that, that depression can happen at any point. Anxiety issues might come up, anger issues might come up, other mental issues might come up. And so to feel free to seek help for each of these things is a very good thing, because it ultimately means that we'll be healthier as individuals, our family lives will be healthier, our social lives will be healthier, and society as a whole will be healthier. So the sooner we can get rid of and reduce the stigma attached to mental illness, the better it is. And I think my personal experience tells me that slowly but surely societies around the globe are starting to change their views of mental illness and are kind of beginning to reduce that stigma.
Mm-hmm. Yeah, I've noticed that as well. It's definitely not where it could be in terms of stigma, but compared to things 20, 30 years ago, there's been significant steps, I think, taken to reduce some of that stigma.
Right. right, exactly. And that's a very positive development.
Yeah. So what do you think about when you think about people getting psychological help?
Yeah, I see getting psychological help as basically getting self-help. It's like helping yourself, helping improve yourself and improving your life. And as well as helping and kind of improving the lives of people around you, important people in your life, like family members, friends, loved ones. Because often what happens when when we're dealing with a mental illness is that that illness might actually affect our relationships negatively. It might affect our family members and friends negatively. So, getting psychological help is not only helping ourselves, not only helping improve ourselves and make us healthier, but it's also helping our loved ones, perhaps, because it's improving our relationships with them. It's it's allowing us to have healthier relationships with them. So that's how I view that. And I also think of getting psychological help as basically a process that involves relying on empirically supported techniques to support or to improve our own health, right? Because in modern psychology today and in modern kind of therapy today, what happens is that most of the time, and this should be the case, we're relying on the therapists involved are providing treatments that are empirically supported. These are treatments that are actually supported by scientific research. And so for me, getting psychological help means going to a therapist who can provide us with empirically validated treatments. And that's very important because that's how we know these treatments actually work and are actually beneficial to our health.
Thank you. What brought you to this field?
That's a very good question. I'm sure everybody has their own unique answer to that. There will be some overlap probably between our answers. For me, one of them was, of course, and this is kind of one of the kind of a simpler reason. It's the need for, or my interest in having a professional career. And this field, mental health certainly offers that kind of opportunity. But I also have a strong scientific interest. I think I'm a very science-oriented person. I think that science is the best way of understanding the world and the different phenomena in it. And so psychology and mental health research are great scientific fields. So I was drawn to them because of my scientific interest. Also, I have an interest in just helping other human beings because I think it's a value that I hold, that I think human beings should help one another and that we should try to reduce one another's difficulties and suffering if we can. And so certainly psychology and mental health fields offer that kind of opportunity. I also have an interest in social justice and in building more socially just societies. And thankfully, what we see in modern psychology and in modern mental health fields is that there is attention being paid to social justice issues. And now there's, psychologists getting involved. And for a number of, actually for decades, I think psychologists and other mental health professionals have been getting involved in social justice promotion. So that's something that's very important to me as well. And I have an interest in that. And that's why, throughout my studies, I've tried to develop this social justice lens through which to look at societal problems and to see what I can do as a mental health professional in training and also as a mental health professional eventually to create a more socially just society.
Thank you. Yeah, and so what do you think is most important about having mental health?
Yeah, mental health is important because mental illness is something that can actually affect multiple life areas. When we develop depression, for example, just to take one common mental disorder, we might find that multiple areas of our life is being negatively affected, right? So this could be our relationships with friends and family members. It could be our jobs, our work lives. It could be our hobbies. It could be we could miss opportunities as a result of having this kind of mental difficulty. And so because of the fact that, mental illnesses can have such a huge negative effect on multiple life areas of a human being, mental health is important because mental health means that you wouldn't be facing so many difficulties in all these different areas. Also, we know that mental illnesses are actually related to physical illnesses. So again, to take one good example, depression is actually related to, cardiovascular disease risk and other physical illnesses and so on. And so one reason that may be the case, one potential reason, is that when we're depressed, we're not being as active as we were before. We're not as physically active. That could result in developing physical illnesses as well, in addition to the depression, which is a mental illness. And so another reason why mental illness is important, mental health is important, is that basically, mental illness could contribute to physical illness as well. So it's of course important to have mental health in place of that, because it reduces our chances of developing or it's less associated with physical illness. And also another reason why mental health is important is because of the fact that in some cases, an absence of mental health and the presence of some sort of mental illness can actually result in harm to other human beings. So for example, we know from the research that's been done that there are personality disorders which are considered a kind of psychological disorder, like for example, antisocial personality disorder or borderline personality disorder, which can in fact result in harm to other human beings, because the persons who are diagnosed with these disorders might engage in violence potentially, or might engage in like exploitative behaviors towards other human beings, especially in the case of antisocial personality disorder. And so some kinds of mental illness could potentially lead to harm to other human beings. And so another reason why it's better to have mental health than mental illness, because again, disorders like antisocial personality disorder could end up harming society and harming other human beings. Another thing to keep in mind is that when people are mentally healthy, they are more likely to treat themselves better in some ways, because we know that people, for example, who have depression might not be as active, as physically active as they can be. They might not care or take care of their health as much as they can be. And so having disorders like depression could actually reduce reduce the amount of care that you take of yourself. And so having mentally healthy people would mean having people who take better care of themselves, and that contributes to a healthier human society overall. And lastly, something that should be taken into consideration is that mental health can either contribute to, or it can be or it can include happiness, which is something. It's a goal that human beings everywhere, or many human beings, try to seek. We want to be happy. We want to have happy lives. And I think a big part of having a happy life is actually being mentally healthy, because if we're mentally unwell, if we have psychological difficulties, that might reduce our happiness in life, right? Because we can easily imagine people struggling with depression or anxiety or psychosis or other issues, and that we can see how that can reduce their happiness. And so a final reason mental health is important is because it can contribute to our happiness in life.
Great. Well, thank you very much for those answers. I really appreciate you taking the time to meet with me today and talk about all this such important information. Yeah.
No problem. And there was I believe there was also one final question about social justice. Was there?
Oh, okay. Yeah. So why do you think social justice is important?
Yeah, so that's a question that's very much relevant to mental health, I think, because social justice, or having a socially just human society, can actually contribute to mental health. We know from research that's been done that people of low socioeconomic status, people who are in terms of economically or economic wealth or economic position, they are on the lower rungs. There's that low socioeconomic status is actually associated with psychological difficulties. And so Another example of how basically social justice factors could contribute to mental health is, or mental illness, is that when we have wars, when we have global wars and conflicts, these kinds of events can actually cause trauma. They can cause, those kinds of psychological issues. And that can, of course, result in a reduction of mental health. So social justice, which can include reducing poverty, which can include promoting world peace, that kind of a thing, having socially just societies can actually reduce the chances that people will develop psychological issues, or will reduce or will improve our mental health, because we wouldn't have to worry about war-related traumas, for example, or we wouldn't have to worry about people being stuck in poverty and then developing psychological difficulties as a result. And so and in an article by a scholar named Raphael, which came out in 2009, he talks about, in that article, he talks about something called the social determinants of psychological health. And these social determinants of psychological health include things like, as I mentioned, peace. It also includes housing, education, access to food, a stable income, and a healthy ecosystem. Now, these are some of the social determinants of psychological health, because these are factors that can actually contribute to a psychologically healthier societies. We can imagine if people are living in peaceful conditions, have housing, have access to education, have access to food, and a stable income, they're more likely to be healthier, happier individuals and more mentally healthy individuals, right? And so it's important, I think, for psychologists and other mental health professionals to be aware of the social determinants of psychological health, and then to try to basically engage in activism or advocacy work, or even peaceful activism work that can help bring these social determinants to the people of every society, right? So we can imagine psychologists getting involved in advocating for certain government policies that provide people with a stable income, for example, or provide people with housing, for example. And since you're providing people with the social determinants of psychological health, you're increasing the chance that people will be psychologically healthier. And you're also addressing social justice issues, because you're giving people a roof over their heads, you're giving people a stable income or access to food. So again, addressing social justice issues can actually address mental health issues as well, because we can actually create mentally healthier societies by building more socially just societies, right? And yeah.
Yeah, great. Yeah, it's interesting how it's all connected, and all these things that can lead to prevention, or in some ways even treatment, kind of all together. So
That's right. That's right. Yes. Yeah.
great. All right. Well, thank you so much for taking the time for meeting me today.
No problem.
It was nice talking to you. I appreciate all your insight and the information that you shared.
Thank you for your time and for providing me with this opportunity. Thanks very much.